Hi guys, welcome back again to my YouTube channel. How are you guys doing? I know you're doing absolutely fantastic. Today I'm going to be talking about a very important and interesting topic, and this topic is how you can become a registered nurse in the United Kingdom without having any nursing background. And I'm going to be mentioning of four categories or four pathways that you can use to become a registered nurse. And the purpose or the reason why I'm doing this video is that recently a lot of people have come into the UK as healthcare assistants or, on any category of, being a healthcare assistant, and they want to upgrade, which is very, very necessary. Some were also nurses already back home, but they don't know how to go about it, how to maneuver their ways. Some have not been able to do their registration from back home. So even though they were nurses back home, they cannot continuously practice in the United Kingdom because they do not have the United Kingdom license to practice as a registered nurse or midwife. However, all hope is not lost. You can still practice in the UK as a registered nurse or midwife if you are happy to start afresh. And if you're wondering, where do you start afresh from? What do you need to do? Then this video is definitely for you. Or even if you don't have any nursing background, you don't even know what nursing is about, but you are passionate to become a nurse, you have that calling, you feel like you being a nurse is going to change, you're going to help people to change their lives, you're going to help people to get better, you have that zeal to become a nurse, then this video is definitely for you. You might be wondering why I'm saying that. Why do you need to become a nurse? Because nursing has never been a good paying job and yada yada. I have been a registered nurse for 10 years of my life. It's the only profession that I have ever practiced, ever, since I came out of high school. I've been a registered nurse. I have my license back home and then I transferred to the United Kingdom. So in total, from practicing in Ghana and the United Kingdom, it's been 10 years since I was called an RN. Anytime I meet healthcare assistants who are under my supervision or people who I think are good clinically or they'll be good people, I tell them it's better you become a nurse. And you're wondering, why do I tell people to become a nurse? Because it's not financially rewarding, but there is job satisfaction. And nursing is part of one of the only few professions in the world that no matter where you travel, you can practice as far as you've got a license to practice in that country or you meet the eligibility to practice in that country, you can still practice as a registered nurse. It's also one of the jobs in the world that is very difficult to lose your job because this is a job that cannot be replaced by robots. It cannot be replaced by people who are not skilled, who are not knowledgeable in the field. So you are almost irreplaceable and you are high in demand any part of the world that you go. And one fact about nursing is that if you explore, there are a lot of opportunities in nursing. It's not only clinical nursing. You can go into other specializations. I've done a video to actually go into details of mentioning specializations in nursing that actually do pay more than just being a clinical nurse. Or when you feel like you don't want to be at the bedside, you are tired. Nursing is not just all about having direct contact with your patient. You can be a nurse manager, you can be a nurse administrator, you can be a nurse educator where you teach other people clinically, you teach nursing students, or you can be a nurse educator in the clinical setting where you assist nursing students who come on clinical placement, you assess them and you give them the support they need whilst they are still on clinical placement. You can also be a nurse researcher. When you go into research, you bring clinical topics. Let's say, for example, the COVID that just ended. You can go into research, do some more research about COVID and its impact on society, and then you can bring it onto board. So nursing is not as boring as we think it is. It's got a lot. Even if you're in a clinical setting and you want to specialize, there are loads of specialties. Every system in the body has its own specialization. So once you start with the foundation of getting your general bachelor's degree in nursing, then if you choose to specialize, you can look for any of these specializations and go into. But to begin with, if you're in the United Kingdom and you want to become a registered nurse, or you are from overseas and you want to come to the UK to study nursing, there are basically or practically four fields in nursing that you can enter into. And number one is adult nursing, number two is pediatric nursing, number three is mental health nursing, number four is midwifery. Midwifery is actually a specialization on its own. It's got to do with antenatal or prenatal, intranatal, that is the delivery of the baby proper, and then postnatal. So that's a specialization on its own. But if you want to do the adult nursing, we have the mental health that looks basically into the human brain and conditions that are affecting, the human brain. And in the UK, mental health nursing actually is one of the specializations that also pay well. So I would say it's also like a specialization. And then we've got the pediatric health nursing who work in neonatal intensive care unit or the NICU. Okay, so if you want to become a nurse without any nursing background, you don't even know what nursing is, but you are compassionate or you are passionate to become a nurse. The number one way you can become a nurse is to do a bachelor's degree in nursing. In the UK, it takes only 3 years for you to become a nurse with a degree. And the entry requirements or the qualification, if you don't have any background at all, if you've got a West African certificate examination from Africa, you can write Ielts with a minimum. It depends on the university's requirements. You can get like a band 6, a band 6.5, a band 5.5, or even a band 5 in Ielts. And then you can apply for a UK university. If you are fortunate, sometimes you can even get a scholarship to come under. But if you are in the UK already, then you can use the same credentials, or you can get a level 3 qualification, or the GCSE. You can use a GCSE, or you can use your MVQ. If you got MVQ level 3 or 4, you can use them to apply. Each university have its own entry requirements, so I would acknowledge you to go online to check the universities and their entry requirements. So that is number one, becoming a nurse with a bachelor's degree, and you can decide whether I want to go into mental health nurse, whether I want to go into pediatrics, or whether I want to go into adult nursing. The ball is in your court. The second option or the second category that I'll be mentioning is if you've got a relevant degree or a degree in another field. Let's say you've got a degree in financing, accounting, agriculture, what have you, you name it. You've got a degree already, but you still want to do nursing. You want to do nursing. You can do masters in nursing without going to do the degree in nursing. So some universities accept these people and they offer these courses. So if you have a degree already, you still want to be a nursing, probably not to be on the clinical setting. You want to be like in administration, you want to be in research, you want to be in management, you want to be in education. You can use this, your relevant degree or your degree from another field, to apply for a master's degree in the UK. How good is this? This is so good to be true. And back home, we don't have these opportunities, because if you want to have a master's in nursing, you must be a nurse already, before you can do masters in nursing. But in the UK, you can do masters in nursing without having to go through, the basic or the foundations of being a nurse. It's very challenging, I am told, because I know people who have done it. It's not easy because you don't know what nursing is about. You don't have the background, but it's doable, it's achievable. People have done it. And so if you've got that passion, you can go online, you can check some of the universities, and then you can apply for your master's in nursing to become a nurse without any nursing background. The third one is to become a nursing associate or a nurse associate or an associate practitioner. So we call them APs or NPs. And currently where I work, we've got a lot of APs who are very hands-on. These people they bridge the gap between nursing and healthcare assistants or senior carers. Their role is a little bit advanced, so they help the nurses with things like medication. However, they are limited to the kind of medications that they can give. They can do procedures like PEG fees, tracheostomies, NG fees based on their competency level. So with this one, you are registered with the NMC of UK. You have a license, just like a nurse, but you are not a nurse. You are what we call the nurse associate or the associate practitioner. But to be able to become an associate practitioner, you need to be in employment of about 30 hours per week, and then you can apply for university to do this associate practitioner. So some of the universities that I know that offer courses for this associate practitioner is University of Bedfordshire, Kingston University, London City University, Open University, and University of Greenwich, just to mention a few. So when you are already in the clinical setting, let's say you are a carer or you're a healthcare assistant, a senior carer, but you feel like you need that upgrade, you want to become a nurse, but you are not there yet. You need some, qualifications and things to cushion you up to help you to become a nurse in the future. But you still want to do things that nurses do. You can do this associate practitioner or nurse associate program. So when you apply for them, they expect you to already be in a clinical setting where you are working. What you can do is that when you go on the track job or NHS job, some jobs are actively recruiting nurse associates. So you can apply to be a nurse associate. So once you feel like you are passionate or you are in the clinical setting and you've got the experience of either being a healthcare assistant or a senior carer, but you need that upgrade, you can apply to the universities to do the nurse associate course. And then once you've completed that program, you can apply for your NMC PIN, get a PIN or a license as an associate practitioner, and then you can start practicing as an associate practitioner. And then in future, if you feel like you need to go to school, you can go to school, do some short courses, and you can become a registered nurse. It takes 2 years to do this associate practitioner program or the nurse associates program. Last but certainly not the least is to become a nurse apprentice, okay, or a nurse by apprenticeship. So you do not have what it takes or the qualification to become a nurse. You can do so on apprenticeship, that is learning on the job. So you learn on the job, you get the skills, you get the knowledge, then you can apply to universities through these apprenticeship programs, and then you can advance or upgrade to become a registered nurse. So basically, these are the 4 pathways. You can go online to read about them, to know the universities that are offering these programs. Don't get stuck in being a carer or a senior carer. It's just a stepping stone. Most people have been there before, but if you are compassionate or you are passionate to upgrading to being a nurse, or you have that courage. And I always tell people that being a nurse and being a carer, sometimes you're a carer, but you're even doing more than the nurse. You're even doing a lot of work. So why wouldn't you rather go to school, just get that qualification, get that license, and put it on top of your whatever you already have the experience, and then jump into being a nurse? And I tell you what, those that already have the carer background and they go into nursing, they easily upgrade. They easily move forward because you already have the practical background. You just add a theoretical background. You can now know why things are done. Yeah. So when you go to the nursing school, they tell you why this is done this way, why this is done that way. You get the license and you can zoom into becoming a registered nurse. It doesn't matter what age you are. Age is just a number. I know quite a lot of people who are very grown. They are like almost reaching retirement, but they still want to have that dream or passion to becoming a registered nurse. And it doesn't end in any age. There is no age limit to becoming a nurse. Basically, you can become a nurse at any age that you want. It's financially rewarding if only you put your mind to it. You can also impact lives. There are a lot of advantages that come with nursing. So if it is something I want to look into, you can explore these 4 opportunities that I've just mentioned in this video and try your very best to attain it. It is achievable. I know you will come back here and testify one day. Thank you so much for watching, for constantly coming back to the channel. Until we meet again in my next video, guys. Bye-bye.